What happens when an EHR company decides to automate everything with AI and not just documentation? Well, here at the Greenway Engage 2025 user conference, AI moved from being a feature to being a foundational part of the company's business plan. I'm talking about automated prior authorization that just happens in the background. I'm talking about patients interacting with AI agents to book appointments and even pay for care and get information about their treatments. Oh, and of course, zero pajama time charting. Here's my summary of the Greenway Engage 2025 event. Let's get to it. Hello everyone, Colin Hung here at the Greenway Engage 2025 conference. It has been so much fun to be here at this user group conference. This summary is not sponsored by Greenway. However, they have paid for some of our travel expenses and they've invited us to be down here. They've had no editorial input into this summary and have no idea what I'm about to say. Now, if I had to pick a theme for this year's event, I'd have to say automation with purpose. That to me stands out as the main message. Greenway here unveiled their master vision for something they call the automated healthcare practice. And that's one where AI isn't just documenting notes, but actually powering the entire practice from the front desk all the way through to the exam room, all the way through to the billing office. Returning CEO Richard Atkin kicked off the conference with a reminder that the company's recent transformation has been very deliberate and very focused. They have continued to put attention on rebuilding fundamentals, on restoring predictability, and removing red tape with their organization. And now, after 8 months of groundwork and a deep partnership with AWS, Greenway seems ready to accelerate the pace of change for their customers.
To my mind, AI is a very, very powerful tool, but it's a change. It's about navigating organizational change and culture.
Okay.
And so, first you have to ensure that people sort of understand the mission, understand where you're going, what the vision is, what the opportunity is, and then you provide training and the experience for people to be able to use it well. So there's the vision for what AI can do, there's skills, there's competencies, and then helping an organization really navigate and transform itself in order to transform the solutions and the things we do for customers. So I really started there. Clarity around where are we going, what was the opportunity, viewing it as a journey for people, for the company as well as for our customers. And what's been flowing as a result of that over the last 4, 5, 6 months is just this tremendous release of energy and potential and excitement. And so it just sort of builds from that foundation, combination of trust and knowledge and capability.
Atkins described how the company isn't bolting on AI on top of their legacy system, but really re-engineering workflows from the ground up across 3 pillars, 3 key pillars. He named them the financial pillar, the clinical pillar, and the patient pillar. Here at the conference, the demo that drew the biggest crowd was, of course, the automated healthcare practice prototype. And it was real. It was built on real code, a real prototype, and basically it allowed people to imagine a practice one day that runs itself, so that clinicians can get back to care and so that administrators can focus on the exceptions rather than the mundane. Imagine AI being able to prep all the charts for the patients you have to see, handling all the prior auths, organizing work queues, and even predicting which claims may be rejected even before a staff member actually sees them. As one presenter joked here at Engage, it's like having a bunch of elves running in the background doing the work on your behalf. By the way, no elves were harmed in the formation of that automated healthcare practice or the creation of this summary. So to me, what this says for Greenway is that they are serious about moving away from clicks and back to care. In fact, that's the new mantra I got from Richard Atkin. But the Greenway Chief Medical Officer, Dr. Michael Blackman, I think, put it best.
Here at Greenway, we're taking a fully all-in approach on AI. And it's not so much AI for technology's sake, but it's AI for what you can do with it. And the more we as we look at the practice as a whole, both the clinical side, the patient side, and the revenue cycle side, there are lots of tasks and other things that are crying out for automation. Whether that's improving the prior auth process, whether that's trying to push things further left in the process. So people talk about in the revenue cycle, well, you manage denials. Well, why do you have the denials in the first place? So what can we do to sort of decrease that number? At the end of the day, there are always going to be some things that are going to fall out that a human's going to have to deal with. But the more we can reduce that, the more we can free people up to spend time on whatever they view as more value-added activities. In some cases, it may be other things in the practice. In other cases, it may be more time at home with the family.
Dr. Blackman emphasized that you can't really just focus on one leg of a stool. You need to focus on all the legs. And so although the company has a hit and has been very successful with their Clinical Assist product, which is their AI scribe, ambient scribing technology, it's time for the company to put focus on the other legs of the stool, namely the financial aspects and the patient engagement aspects. And they really need to focus on those in order to bring balance to their entire EHR platform.
As we look at how do you put the joy back in the practice of medicine, the EHR as a whole, when it first came, it had a lot of promise. I think it still does. But did we get all of the promise and all of the benefit that people sort of suggested early on we were going to get? Yeah, probably not. But we can start getting back to that and saying, okay, what can this really do? And it becomes your thought partner, your helper, your automatic, your instant consultant, whatever the case may be, and I want to view it, and not simply this thing I have to go use.
When I sat down with Troy Wasilefsky, Greenway's Chief Revenue Officer, he didn't mince words about where the EHR market stands.
I might suggest that you're being too kind in suggesting that the market's been stable. I think it's been stagnant.
Okay, all right.
I mean, the EHR market is one in the ambulatory space that I think has been stagnant in the sense of innovation at any sort of real scale or level. It's been complacent and frankly hasn't been serving the customers out there all that well for many, many years. How much has it really changed, right, over the past couple of years? The products that are out there, not that much. So how do you grow? How do you make money? By disrupting it.
He sees a window of opportunity for Greenway to disrupt through automation, and as he put it, solve an age-old problem with modern technology.
I think we're solving a bunch of age-old problems. This is substantial lack of efficiency, EHRs actually becoming a problem for clinicians as opposed to a supporting mechanism, right? I had a customer tell me the other day after seeing our new product, this is different because the EHRs were supposed to support clinicians, they control clinicians.
Ooh,
right?
I like that, okay.
So I think we're changing that concept and actually allowing clinicians to solve another problem, which is spend more time with their patients. We're solving the problem of substantive revenue leakage because of the technology solutions that our providers have to use today still can't plug those gaps, or actually in many ways cause those gaps to open wider, right? So it's a big set of age-old problems. At the heart of it, though, is we want our practices to be successful, right? To earn the revenue that they deserve for the work that they do, and not let that revenue leak out. And second, we want our practitioners, the clinicians, to be able to spend more time with their patients.
Troy says that this is a once-in-a-lifetime opportunity to finally make technology fall into the background and let providers focus on care. Back to that whole clicks to care mantra. And all the Greenway customers I spoke to here at the conference had the same positive story to share. Clinicians who were once skeptical about AI scribe technology now can't imagine working without it. Everyone here who's using Greenway's Clinical Assist just loves it, and it has truly reduced and eliminated the pajama time documentation that they used to have to do. At the customer panel, which by the way was really diverse in terms of gender, in terms of size, in terms of types of clinics, so kudos to Greenway for such a diverse panel, there was one physician who said, the Greenway Clinical Assist caught details that she missed while thinking about the next question to ask her patient. And when she checked the transcript, the system was right. And it's that kind of accuracy which builds trust and will increase and accelerate the adoption of this type of tech. Another big headline here from Engage was the deepening partnership between Greenway and AWS. And Greenway is leveraging HealthLake for data access and Bedrock for model development and a new Agentic AI factory to rapidly create tools that can reason and act rather than just automate.
And then going beyond that, in the last few months, we have deepened that relationship further with a true co-development partnership to create an agentic capability, the latest sort of power of AI, agentic capabilities that can reason, not just analyze and automate, but can help reason and provide guidance. And so we have, in the last 2 months or so, built the foundation for an agentic AI factory, as we're calling it. It's not a factory in the sense of bricks and mortar, but it's a capability which is a foundation for rapid innovation of agentic AI tools. And we've already created 4 agents from our agentic AI factory, and we plan to create many, many more. So it's about speed and innovation. So AWS is central and key, and they're great partners of ours.
I found it pretty interesting that Matt Pearson, who is the senior leader for healthcare and life sciences at AWS, went out of his way to mention that Greenway was one of the very few companies that AWS works with that's actually making meaningful progress on how AI is deployed in healthcare. He said that he speaks to many digital health vendors who really just give lip service to their product plans and their product roadmaps. Greenway is one that's actually doing it. I will say that Dave Cohen, the Chief Product and Technology Officer at Greenway, got a shout out from the team at AWS. Now, speaking of David Cohen, I had the opportunity here at Engage to ask him for more details about their AWS partnership and about their new partnership with Moxe.
Yeah, we're excited about the partnership that we have with Moxe. We've been working on that data transparency initiative for quite some time. And part of that is, there were some crawl, walk, run steps that needed to happen, right? We made some investments with AWS on our HealthLake platform to make that data more accessible, to more broadly across the industry. And one of the things that our customers have been asking for, in addition to things that we're already doing with Commonwealth around clinical data exchange, is now how do we create that connectivity with payers and other parts of the healthcare ecosystem. So with our partnership with Moxe, we're really opening the door now for provider to payer data transparency. Today, that's something a lot of our customers are doing manually. So they get these information requests for patient records, whether it's for data, retrieval of information or chart auditing, and in many cases, that's a manual request. So for us in that Moxe relationship, it's a way for us to automate those types of retrieval requests. And as we've been talking about doing that for quite some time, Moxe is a great way for us to just get started, right? So one of the things we like about their platform is they have a number of established payers that they're already connected to, and they also do a lot of data translation. So what we're finding on the payer side is that payers take data in different ways, right? Some of them are able to take CCDA, some are able to take FHIR, but working with Moxe, it's a great way where we can be kind of disintermediated from the way payers want to get data. The other thing we really like about what Moxe offers is that they have a dashboard that we're able to give our customers access to. So there's full transparency about, hey, who is your data being shared with? And they can log into that customer portal and be able to see, okay, here's where our patient data is going.
Of course, no summary would be complete from me without at least some highlights from the exhibit hall. And here at Greenway Engage 2025, the exhibit hall was full with Greenway's partners, and here are a few of their key takeaways from the conference, as well as notes about the conversations they were having with some of the practices assembled here.
This is James Zaida, Director of Business Development and Strategy for Medicom Systems. And we're very happy to be here at Greenway Engage 2025, supporting the products and their new suite of products, GCA and AHP, bringing all new functionality, particularly in the world of ambient listening and AI, to clinicians at the point of care. And Medicomp, as always, has been a proponent of structured data and making the lives of clinicians much easier at the point of care to benefit the patient throughout the care continuum, and we are here showing our tools to make all of that easier as well, and very excited to bring that to the folks at the point of care and beyond.
I'm Alex Pollock with Moxe Health.
Guy Bergman with Moxe Health.
And this is our first year at this, we're a new partner with Greenway.
I think a good takeaway from the conference has been, obviously with AI and being 2025, it's surprised me how many practices still use paper when billing patients. That's what we do at Moxe Health. We help automate the patient billing experience with digital communication, and it's striking how many healthcare practices still use paper, kind of that old school method, and need help with the patient billing experience. So they really found our solution to be refreshing and something that they can benefit from. So that was my takeaway.
Hi, this is Josh Mesha with RevSpring. I'm our Director of Marketplace Partnerships. Throughout the conference here in Tampa this week, and given our position in the market within the patient communication, payments, and merchant processing space, what I feel has really resonated with a lot of the attendees is the ability to give a patient a consistent experience from start to finish, from self-scheduling all the way through to post-claim adjudication payments. Through the RevSpring partnership with Greenway, we're able to provide integration back into both Prime Suite and Entergy for both pre-care as well as post-care services.
Hi, I'm Jake Jenner. I work for Solventum.
And I'm Brandy Guy. I'm with LK.
And the hot take of this conference is everyone's willingness to engage in discussions surrounding all sorts of solutions. It's been really refreshing to talk to a lot of these people here.
Yeah, and it's great to discuss how the innovation and expansion of interoperability is helping shape the healthcare IT industry.
It's been very interesting to see the difference between last year's Engage and this year's. There's a palpable change in tone, in approach, and in the scale of the announcements made here at the conference. Of course, one big difference is that Richard Atkin is back as CEO, and he's really pushing the company to accelerate their efforts to become an AI-centric organization and to really build AI deeper into their EHR platform. But even bigger is the impact that the Clinical Assist product has had on Greenway's customers. This year, many more customers were talking about how much it has made a difference in their practices. And because of that success, there was genuine excitement over the company's new AI plans. There's a growing belief that Greenway is on the verge of something here, or as Troy Wasilefsky put it,
Greenway is now a different company. And we are a different company bringing a completely new transformative solution to them. And I want them to be excited about that. Give us the chance to show that to them, for them to give us feedback. But they should expect a transformational experience with us over the next couple of months.
Okay, I want to thank the team at Greenway for being so welcoming and for putting on a great event. I learned a lot while I was here, and I appreciated the unfettered access they gave me to both the technology and the people attending. I can't wait to see what the company does in the next 12 months. I'm Colin Hung. Thanks for watching, and I'll catch you on the next video.